forms.
Do you want me to go back to the first slide?
We can start here.
Okay, perfect.
All right.
All right. So I think it'll still let me keep sharing even though I'm not the host anymore because it still says I'm sharing. So as long as everybody can see, I'll keep going from here.
Sounds good.
I'm also going to take my gum out of my mouth. Okay. So yes, the Pregnancy Promise Program is funded by the Centers for Medicare and Medicaid Services and the Department of Health and Human Services. The contents of this presentation have been prepared by us at FSSA, which is the Family and Social Services Administration, and do not necessarily represent the official views of CMS and HHS. So there are many reasons that this new program is important. According to the report that was put out by the Maternal Mortality Review Committee in December of 2020, OUD has been increasing in Indiana and nationwide over the past several years. It was found that SUD is the most common contributing factor to It was found that SUD is the most common contributing factor to maternal deaths, likely contributing to over half of the pregnancy-associated deaths in 2018. Additionally, 87% of the pregnancy-associated deaths were preventable. Treatment during pregnancy has had a high rate of success, and for the Pregnancy Promise Program, the case managers will be working with pregnant and postpartum members on engaging in pharmacotherapy. So what is the Pregnancy Promise Program? It is a free and voluntary program for pregnant Medicaid beneficiaries who have current opioid use or have used opioids in the past. The goal of our program is to identify these individuals as early in their pregnancy as possible and help them get entered into prenatal care, as well as access opioid treatment needed to achieve sustained recovery and make sure that they're receiving ongoing support and follow-up care for both the mother and the infant during pregnancy, after pregnancy, and during pregnancy, at delivery, and then after pregnancy. And we really want to help them provide a hope and set a strong foundation for the future. So the Pregnancy Promise Program is available to all pregnant individuals in the state of Indiana who receive Medicaid and have previous or current or previous opioid use, and we are serving all 92 counties of the state. So to be eligible, they must either currently be pregnant or within 90 days of the end of their pregnancy. And I do want to add that that's regardless of what the outcome of pregnancy is. So if there's miscarriage, if baby is put up for adoption, or baby is with DCS at birth, whatever the outcome of the pregnancy is, the individual is still eligible for this program. And then, as I already mentioned, they must have current or previous opioid use, and then they must be either currently receiving or eligible for Medicaid health coverage. So the Pregnancy Promise Program participants will be matched with a case manager through their managed care entity who will be with them from the time that they consent to enroll in the program through 12 months postpartum. By having one singular case manager and not changing after birth, this will give the member and the case manager a great opportunity to build rapport and ensure the member's needs are being met. The Pregnancy Promise Program case manager will work with the participant to coordinate care with all of their providers, including doctors, behavioral health, home visitors, really anyone who's going to help the member and infant reach their best possible outcomes. As a result of the connection and coordination efforts, the Pregnancy Promise Program aims to reduce and prevent the negative impacts of opioid use for both the parent and the child. So as I mentioned, we've partnered with 4 of the managed care entities in the state. So Anthem, CareSource, MDWise, and MHS are where our case managers are located. So what does the program experience look like? As I mentioned, we're trying to find the pregnant individual as early in their pregnancy as possible. It has been found that a lot of individuals who are pregnant and have opioid use disorder have less than 5 prenatal appointments in their entire pregnancy, and we're really wanting to help them get engaged and get as much care for their pregnancy as early as possible. We have a no wrong door approach to referral, so anybody can refer somebody to the program. We have a public facing website that has this, when you go to it, it has a nice big green button that says enroll or refer. We really try to make it as easy as possible to find where to do that. Um, Once an individual is referred, we do have to get consent from the enrollee. As I mentioned, it's a voluntary program. So even if somebody is referred and it would be a good program for them, if they do not consent, they won't be forced to participate. Once we have their consent, we'll begin working on enrolling in the program. And they go through several different assessments and screenings to really find out what the needs of the individual are and how the case manager can best help them. And once all those assessments and screenings are complete, then they will work to develop a care plan. And we really encourage the individual to include people who are supports for them in the development of their care plan once a release is signed. So if they have a therapist or a provider that they've already been working really well with and has been a good support for them, we do encourage for them to have anybody engaged in the treatment that would be a good support for them. Once that care plan is developed, they will begin in frequent engagement, both prenatal and postpartum, with their case manager. Case managers will be meeting with individuals at least every 2 weeks leading up to birth, and even more frequently as they get closer to birth. Those encounters can be either like over the phone or virtual face-to-face. A big part of the grant was encouraging that in-person interaction. However, as I'm sure everybody knows, with COVID, things are still a little iffy, I guess, if you want to say. So it's definitely at the comfort level of the member and the comfort level of the providers, because our main goal is to keep everybody as safe as possible. So as things progress and get a little more normal, whatever normal is, then we will really encourage that face-to-face interaction once it is safe. Um, Throughout their enrollment, there will be periodic review and reassessment, as well as making referrals to really make sure that all of the needs for both the member and baby are being met. And then they will receive that care coordination through 12 months for both the mother and the infant, as mentioned. And then at the end of that 12 months, the case manager will really work with the member on transition and program exit. And this will really be dependent on each individual person's circumstance. If it's somebody who's still in the income guidelines and will still be eligible for Medicaid, then they will work with them on transitioning to what their insurance coverage with Medicaid will be. If it's somebody who'll no longer have Medicaid and they're transitioning to a different insurance or a different option, they'll really work with them to make sure that they're ready for that transition, whatever that will look like. So as I mentioned, this is a CMS grant, so we do have several program measures that we will be sending back to the federal government. So we'll be working on addressing the health-related social needs of all of the enrollees. We're not only going to be working on pregnancy and OUD related needs, while those are obviously very important, but we'll also be making sure that if they need help with transportation or nutrition or childcare, just whatever they need, making sure that they have the resources to get those needs met. We will be working with them on initiation and engagement of OUD treatment, as well as continuation of that pharmacotherapy in pregnancy, at delivery, and afterwards. We will be working with them to make sure that they have access to postpartum care and are attending those postpartum appointments and pediatrician appointments, making sure that they are know about healthy birth spacing and the recommendation for 12 to 18 months between pregnancies for the best outcomes for mom and baby, as well as having access to family planning and long active reversible contraceptive. And then we'll also be tracking infant outcomes and really seeing how if there's been if there's any reduction in low birth weight or NICU stays or babies born with NAS or NOWS. So another part of our grant is increasing provider capacity, and we've done this by partnering with IU Project Echo, and we're providing 3 different free training tracks that have CMEs and CEUs. The first track is for treating OUD in pregnancy, and that's really geared towards the providers who are caring for the pregnant members. So in the tracks we've had so far, we've seen like a lot of OBs and individuals working with those pregnant members. The second track is for caring for infants with neonatal abstinence syndrome and neonatal opioid withdrawal syndrome. And that's really geared towards providers who are in the NICU and pediatric settings. And then the third is for supporting OUD in pregnancy. And this is really geared towards case managers, community health workers, and home visitors who are working closely with those members. As I mentioned, we do have a few different ways you can get a hold of us. If you want to make a referral, you can go to that website, or you can always send us an email or call. We have both a toll-free and a local number, and we're always happy to answer any questions that anyone might have. And then as we worked towards launching the program, we went live on July 1st of this year. So we're still pretty new. But as we worked on, getting ready to launch the program, we've really been meeting with as many agencies across the state to really make sure that people know about us. And that way, we can really just help as many individuals as possible. And really, this is not even close to an all-inclusive list. We're always looking for more groups or agencies that we can talk with to just make sure that we're able to find and help as many people as possible. And so, yeah, that's what I have today. I have my contact information, and then also Elizabeth Wall, who's our program manager, and I believe she's on the call with us. So we're glad to answer any questions that you might have.
All right. Well, thank you so much. Just off the top of my head, and anyone, if you have questions, feel free to chime in or put it in the chat. But since July, how many women have been enrolled in the program?
So as of last week, we were at 65 fully enrolled. Our goal in the first year is 750, and the case managers have made outreach attempts to over 500 at this point. So they're definitely actively trying to get a hold of people and make contact with them. And then we meet with the case managers every other week, and they update us on how many they've been able to enroll in the program.
Okay. Awesome. Does anyone have any questions for Carrie?
I was just going to ask, what are these case managers specifically just for this program? And if so, are they receiving, and if not, or I guess if they are too, are they receiving special training of how to just approach the women that are entering into the program?
Yeah, so the case managers who are working on this program were previously with the MCEs. They are all RNs and licensed clinical social workers. They do attend the ECHO trainings that are being provided that really, teach how to work with this population, as well as every other week we do have the case manager meetings, and we have presenters come in and teach about different areas that are helpful for when working with this population. And it is also it's a tough population to work with. There's a lot of people in really hard situations. So we're working with them not only on how to help the members, but also making sure that each of the MCEs have programs and steps in place to make sure that the case managers are also being taken care of, and making sure that there any stress or any mental health needs that they have are being addressed.
Okay, Great, thank you.
Are you able to give any more information about the ECHO programs or the trainings? I've been trying to catch them where I can, and I found them like resourceful at least. So if you're not aware of them or able, maybe be able to attend, they're pretty helpful.
Definitely, and I can send you the 3 different links. Currently, the only one that is running is the neonatal abstinence withdrawal, neonatal abstinence syndrome, the NAS track, but all 3 tracks will resume again next year. So I can send you the links to those, and I believe you can go ahead and register for them now. And then that way, when the tracks restart, they'll already be on your calendar, and you'll be able to attend. And they're open to everybody. So even, I mean, I'm obviously I'm not an OB, but I've sat in on the OB track, and it's so interesting to just learn all of the different information.
And from the participants that you do have in the Pregnancy Promise program, are they in certain areas of the state, or is kind of like broad area?
We've really we're a little bit all over the place. We've seen several different counties. We are open, and we do serve all 92 counties, but we're seeing them in different areas of the state. It's not all like Marion County. It is different enrollments around the state.
Okay.
So I guess, Carrie, if they're all over the state, do you have case managers all over the state? And I apologize if you said that and I missed it.
So currently we have case managers in about 9 different counties, but we are the MCEs are partnering with community health workers and peer recovery specialists. So if there is something where the individual wants somebody to go with them to an OB appointment, if the case manager isn't able to make it, they will be able to get somebody who is close to them there to support them.
And Jennifer, do we know if everybody on the call is familiar with our maternal death rates? Have you sent that information out?
I don't believe so specifically.
Okay.
So you're more than welcome to kind of cover that if you'd like.
Yeah, I think Kathy, you're on the call too. I don't know if anybody else from our maternal mortality review team is on the call, but we had I think Jennifer for sure gave just an overview of the percentages of maternal deaths that are related to substance use disorder. And they actually pulled in a few different people like myself working in substance use disorder as a social worker across the state to kind of give that different perspective to the maternal mortality review committee. So it's really interesting to sit in on that and to really have a deeper understanding of what is happening and when these deaths are occurring and how they could be prevented. So if there's anybody that's on this call that is, in the OB world and has interest in being on that committee, I'm sure that when they renew the committee, they'll be looking, people come and go off the committee as their schedules change. So it's really an interesting committee, and it gives you a really good perspective on what's happening in the state. We were pretty flabbergasted that, we do about 10 to 12 cases, sometimes a few more per meeting, and we meet once a month. And a couple months we had, 9 overdoses as the reason for death, the cause of death for these moms. So it's pretty eye-opening to look at that and kind of look at what resources we have and how we can use resources to do education across the state, and where we're lacking some resources, we can reflect on what we have in our own community and what our own docs are aware of that's going on out outside of that hospital network that we could maybe make some change for inside the hospital network and inside those doctors' offices and delivery rooms. So just it's an interesting data set if you want to look at the numbers that we put together. I know they're linked on my website. I'm sure they're on the State Department of Health website. I can try to find them real quick and put them in the chat in case anybody's interested.
And I can send everyone the annual report as well. One of the things that I will also send is this. I'm going to share my screen really quick. There was just kind of a fact sheet on maternal mental health and suicide. And one of the things that stands out, just kind of like what we're talking about, is drug-related postpartum deaths by suicide and overdose. The numbers are obviously very high across the country, but we can send the report more specific to Indiana, but this definitely helps to start different conversations. And, you know, as we're trying to change this conversation and support our moms in whatever way we can. So I will also send this for you guys as well, if you want to share with your clients and moms even. So do you guys, are there any more questions for Carrie regarding the program? I'll also send out her the PowerPoint that you used as well. There was some information to connect there, so I'll send that.
Would you please share Carrie's email? My name is Tamika. I'm from United Healthcare.
Yeah, her email is Carrie, C-A-R-E-Y .Michaels, M-I-C-H-E-L-S at FSSA.in.gov.
Thank you.
You're welcome. All right, well, thank you, Carrie, so much. I look forward to seeing the results over the next few, year, and hopefully any way we can help support this program and moms in our community, we'll definitely be directing them your way.
Thank you.
Absolutely. I want to introduce Jennifer Hope. She is the founder and director at The Mom of an Addict. And I appreciate you joining us today just to kind of give us an overview of your organization. If there are people here who aren't familiar with it, I just would love to share about what you do.
Well, thank you. And I apologize for being on here a little late and for the mess behind me. We had an event Saturday, and this week of wrap up and catch up and follow up has done a number on me, but I'm glad to be here and thank you for inviting me. Our organization, The Mom of an Addict, provides education and support to families, friends, really anyone who has been affected by a family member or loved one's substance use disorder. We currently run one support group meeting here in Fort Wayne. We run one in Warsaw, and we are holding a facilitators training in October to start new meeting locations, because we know that Tuesday at 6:30 doesn't work for everyone, especially at the location we have. So we want to come around town and meet people where they are. But we have a 20-lesson curriculum where we talk about all different types of things related to substance use disorder, about the science behind it and why it is a disease, what happens inside the brain of our loved one, really communication, the types of treatment, the types of drugs that are out there, the stages of change, the dad's perspective, dealing with loss, just a whole myriad of topics. We have times for sharing where people can come and just really remind us that we're not alone, that substance use disorder is in fact a disease. It's not the result of a parenting failure or, family dysfunction necessarily, and it's not a moral flaw on the part of the person. So we always want everyone to know that they're not alone. And the other thing we do is bring in guest speakers. We have professionals around the community come in and share their expertise. We've had an attorney come in and share about expungement, because many people thought that if their loved one had a felony in their background, they could never get a good job, and that's not true. We've had people come in and share their recovery stories. We've had, a judge come in and share about the things that they're doing in the court system here in Allen County. And really, it just boils down to just providing people a safe place to let them know they're not alone.
Thank you. And do you want to share a little bit about the event that you had on Saturday?
Sure. We held the second annual Recovery Rocks to go along with Recovery Month, which is September. We had it at Sweetwater. We had a few resource tables that weren't able to make it due to some sicknesses, but I think we had 49 actually there for lots of different services for mental health and substance use disorders and overall wellness. We had speakers share why help is available, why help is important, why taking that help, asking for that help is important, why community is necessary for us. We had a therapist talk about, her topic was spilling the tea on therapy and why it's good to go to therapy and why there shouldn't be a stigma attached to it. We had food trucks, we had music. I think we had almost 550 people there. So we're already making notes and working on ways to make next year even better.
Well, thank you so much for sharing about the mom of an addict. Are there any questions for Jen? Writing her program. I will also share some social media links and information on your organization as well. So if there's any people who need to get connected or families that need to get connected, obviously it's a great resource in our community.
Thank you. Appreciate the opportunity to share. And again, I'm sorry I was late.
No problem. Traffic. It's traffic right now.
We can go with that.
So everybody, I appreciate your time today. Are there any questions or anything from an organizational standpoint that you'd like to share with people who are on? Or it's kind of open. And if not, then we'll meet next quarter. Awesome. Okay, well, I appreciate everyone's time, and I hope you have a wonderful day. And if there's any questions, you can always contact Mary Claire or myself, and or any events or anything. Always the DAC is very good at sharing all the information about what's going on in our community, and as well as my brain just stopped. Basecamp is also really great if you're not a part of it. So anyways, well, thank you guys so much for your time, and we will talk to you soon.